Today, in this video, we are going to discuss surgical safety checklist. This surgical safety checklist is used routinely in our hospitals whenever we are about to operate a patient. The surgical safety checklist has three major components. Number 1, the sign-in phase. Number 2, the time-out phase. And number 3, the sign-out phase. Remember, there is no time-in phase. Let's discuss this one by one. The sign-in phase. The sign-in phase is when the patient is shifted from the ward to the OT complex. Now, the OT receiving nurse or the staff who receives the patient from the ward will do the sign-in. And in the sign-in, the identity of the patient is confirmed. We make sure that we've got the same patient and not somebody else. So there is a tag which is put in, which has the name with the registration number of patient. So identity is checked. The registration number is checked. Okay. The diagnosis is checked. The procedure planned is checked. Then the other thing which is checked, and a very important one, is whichever site is to be operated that needs to be marked with non-erasable ink. Now, what does that mean? Supposing we have to do a right-sided breast surgery, so my team member in the morning is going to put a mark on the right hand with non-erasable ink, right? To signify that the surgery is on the right side, and this we confirm from the patient also. We ask the patient to say which side is your surgery planned? Which side is the problem? Then we cross-check with the reports and then we put that mark. Now, until and unless this mark is put, the patient cannot be shifted to the OT. Or the nurse will not allow the patient to be shifted to the OT. So site marking also prevents wrong side surgery. We also have to find out if the patient has any allergies. If the patient has any allergies, they has to be documented in the sign-in phase. Last is prophylactic antibiotics are given to the patient. Now after this, second one is the timeout phase. Timeout phase is take place when we are about to start the surgery, so before introduction of anesthesia or before incision. See, there are two nurses in the OT. One is the scrub nurse who washes up with the surgeon, and the other one is the circulating nurse who will hand out instruments. The circulating nurse says time out, and everyone stops. The first thing which everyone does is everyone introduces themselves to each other. Then we recheck the identity of the patient. Then the surgeon has to say what is the diagnosis. What is the procedure which is planned and how much time will be taken. Procedure plan and time required to carry out the surgery. So these are the things which are asked from the surgeon. And the anesthetist will tell us what is the ASA grade of the patient. The anesthetist also has to say any risks associated with the patient. Whether the patient diabetic or hypertensive. Are those risks involved in this patient or not? And the anesthetist also asks a very important thing. When was the prophylactic antibiotic given? What time was it given? So, the best time to give prophylactic antibiotic is 30 minutes to 1 hour before surgery. The nurse who's washed in with going to be asked that has sterility been confirmed, and are all equipments in place, all equipment required for this procedure are in place or not. Okay, so these are the questions which are asked in the timeout phase. Now one more thing which is very important, which is asked from the surgeon, is the expected blood loss. So now once the surgery is done, we move to the sign-out phase. So sign-out phase is at the time of skin closure. Now in the sign-out phase, what is the role of the surgeon? The surgeon is asked what is the actual surgery performed, any complications and any equipment issue which they faced during surgery. So all this is asked from the surgeon. The nurse has a very important role in the sign-out phase. The nurse is asked all the gauze pieces and equipment counted for. So you know that we use gauze pieces and we use mops during surgery. Those smaller ones are gauze pieces. The bigger white one is the mop. So gauze count and mop count, is it correct? So, if they opened up 10 gauze pieces before surgery, have they counted 10 gauze pieces again? Is something being left inside? So all these have to be counted. All needles and equipment count. Is it correct or not? Now this is very important, and complications can happen anywhere. Okay, so this surgical safety checklist helps in preventing problems, and this counting of gauze pieces and mops and needles and equipment is very important so that nothing gets left inside. Another thing is that if a specimen was removed, has the specimen been labeled? So whatever specimen you've removed for pathology, has that been labeled or not? And finally, the anesthetist has to say, the actual blood loss, the final say is always given to the anesthetist. So these are the 3 phases of the surgical safety checklist.